1 minute to the broadcast, and the live
We could have
stream
the
has
speakers
started.
come up and line up in order. It would be y'all. We are about a minute out. Is that right, Viv?
35 seconds.
Recording in progress.
Seconds out. How's the sound for everybody? Sound okay? Good, thanks.
Has the interpretation started? I haven't heard anything in Spanish and live.
Interpretation will not start until the live stream starts. The press conference can start at any time.
Hey, good afternoon to everybody, and welcome to the media gathered here at City Hall and to viewers who are watching us on social media. I am Beverly Thompson, Communications Director for the City of Durham. I need to also let you know, too, that for our Spanish neighbors, this press conference is also being broadcast on our Spanish language Facebook page, Ciudad de Durham. So please know that that's there and available for their watching. So again, we invited you here today to provide an update on how the city and the county are continuing to manage COVID-19, the pandemic, and its effect on the community. Speaking to you today in this order will be Durham Mayor Elaine O'Neal, Durham County Board of Commissioners Chair, I can get that out, Brenda Howerton, and Durham Public Health Director, Jenkins. After they complete their remarks, we will open it up for your questions. Please use the microphone here to ask your questions so that people watching at home via social media and people watching at home can hear your question, and so that the media here can hear your question. So thank you so much, and I will turn it over to Mayor O'Neal.
Good afternoon, Durham, North Carolina. Good afternoon, and thank you for being here today. I also welcome any viewers who might be watching on Durham social media or on television. As you know, the pandemic continues to pose serious challenges for our nation and for our state and for our great city and county of Durham. Thanks to you, our community, and your compliance with our guidance, you know it, wearing masks, getting vaccinations, and boosters, Durham is leading the way in managing and reducing the impact of COVID-19 virus and the variants. As your mayor, please be assured that I take every inquiry from Durham residents and businesses seriously. I have heard from many of you over the past few weeks and days regarding your concern about the rapid spread of the Omicron variant. Let me say clearly that your health and safety are my and other elected leaders' top priority. Just a few short weeks ago, a little bit over a month, as a resident of Durham, I listened and learned from available resources. However, as your mayor, I now have some of the best resources available to help me get up to speed on the science, the management, and the necessary communications to residents about how we together can best protect ourselves. Over the past few days and weeks, I have been in contact with our county partners, especially our Durham County Commission Chair, Brenda Howerton, and Durham Public Health Director, Rod Jenkins, as well as top leadership at the world-renowned Duke University Health System. They, in turn, primarily Public Health Director Jenkins, are in almost daily contact with other state and national officials, including the North Carolina Department of Health and Human Services and the CDC. I have been and will continue to rely on them for guidance in Durham's response to the pandemic. As we have from the start of this dreaded pandemic, the city and county continue to count on the guidance from Public Health Director Rod Jenkins. His leadership and advice have positioned Durham to be at the forefront of managing this virus. I will continue to lean on his expert direction to determine if and when there should be any loosening or tightening of restrictions in Durham. He will explain more about where we are in managing the virus, as well as our next steps in a few minutes. Again, we thank you all for coming and helping us provide information to the public on what Durham is doing and recommending to our residents to continue to mitigate the spread as well as the impacts of COVID-19. I ask you all to remain calm, firm, resolute, and determined to stay safe and well while carrying out your everyday lives. We are Bull City Strong. And I now turn it over to our chair of our Board of County Commissioners, Brenda Howerton.
Thank you, Mayor. Good afternoon. I am Brenda Howerton, Chair of the Board of County Commissioners, and it is my honor to be here and to bring you words from the county. I'd like to also recognize any members of my Board of County Commissioners that's in the room. I see Commissioner Burns is here, and also Interim Manager Hager, our Public Relations Director, Deborah Craig Ray, is here as well. So let me begin by offering my heartfelt thank you for all of our health professionals and our staff across this community who have worked nonstop to respond to this ever-changing COVID-19 pandemic. Please know that we honestly value your tremendous work and sacrifice to help our residents with this public health crisis. As we prepare to hear from our Durham County Public Health Director, Rod Jenkins, very shortly, I feel it is important to review the actions and policies enacted by your local elected officials over the last 18 months. I will tell you that our goal has been to manage and address this public health crisis. This, like all of the nation here in Durham, we are experiencing in more than 100 counties, this is like nothing we've experienced in 100 years. And we're experiencing it all across the state of North Carolina and beyond. We remain determined and committed to doing everything possible to help you keep yourselves safe, to make sure that your children are safe. Following the initial state of emergency enacted by Governor Cooper in March of 2020, the city of Durham and then the county of Durham, each in turn followed suit. Please remember that Durham was among the first communities in our state to implement the stay-at-home order. Initial restrictions were expected to stay in place about 6 months. But as the pandemic continued, our city and county leadership put in a more restrictive order calling for face covering masks to help slow down the spread of COVID-19. We combined the two city and the county orders to avoid confusion among our residents. As the months wore on, our local masking guidance remained in place. We moved forth over time, continuing to extend our orders. We were more restrictive with some of our safety rules than our state, all with the goal of seeking to protect our Durham citizens. When the governor's executive order began relaxing some of the earlier safety rules, our Durham leaders remained steadfast with his rules on wearing face masks and more. To be clear, we currently remain under a state of emergency to prevent the spread of COVID-19. Wearing masks in indoors settings and still in effect in Durham County. Our collective thought has been to keep the order in place as we continue to manage this virus and to use our city and county communications resources to promote public awareness of the continued use of best practices to best fight this pandemic. Our work has been guided by data, science, and state law, and we will continue to work with our experts as we go forward. Let me now call on my health director, Jenkins, who will share critical detail about the surge of this virus and tell us to remain safe. And the protocols, because he's the one that's in touch with CDC. So he will give you the protocols as to what needs to happen. Thank you so much.
Thank you, Madam Chair. Good afternoon, and thank you for joining today's briefing. Durham County currently has 4,566 active cases of COVID-19, with a 7-day moving average of 660 positive cases. Hospitalizations have increased with this new variant of COVID, and sadly, 282 people have lost their lives due to COVID. I'd be remiss if I didn't say most of the hospitalizations are attributed to unvaccinated individuals. A few points for you to consider. In 2021, Durham County had 25,894 cases, with an average of 2,123 cases per month. In January alone, and we're still in January, we've seen 5,993 cases. And this is directly related to the surge in Omicron and the holiday activities. As of 2021, 71.8% of the population 5 and over was fully vaccinated here in Durham County, one of the highest rates in the state of North Carolina. Durham County's 7-day moving average per 100,000 of the population is significantly less than North Carolina as a whole and the United States. In 2021, nearly 50% of the cases were among those less than 30 years old. Vaccinations and boosters continue to offer the best protection against the Omicron variant. To find out more, ladies and gentlemen, please visit Durham County's COVID data dashboard at decodepublichealth.org/COVID data. My message today is going to be simple. Vaccinate, get your booster, wear your mask, get tested. The top things that you should consider doing to act now and remain safe and to reduce the transmission of Omicron. Number one, you should make sure that you're up to date on your COVID vaccinations and booster doses if eligible. You should encourage friends and family who are not up to date on COVID vaccinations to get vaccinated or boosted. You should avoid indoor gatherings with people who do not live with you. Outdoor activities are safer. If you are gathering indoors with people who do not live with you, you need to wear a mask. Wear a mask in public indoor settings, regardless of your vaccination status. Stay at home if you are sick and get tested for COVID if possible. That's worth repeating. Stay at home if you are sick and get tested for COVID if at all possible. Last but not least, continue to practice 3 W's because they have served us well throughout this pandemic experience. Make no mistake about it, Omicron is the most contagious variant we've seen yet, and it's set record high case numbers daily. I implore you to get vaccinated, get boosted, wear your mask, and get tested. Vaccines are still available widely here in Durham County. Our vaccination clinic at 414 East Main Street is open Monday, Wednesday through Friday, 9 a.m. to 4 p.m., Tuesday for extended hours for those with flexible schedules from 9 a.m. to 5:45 p.m. Vaccines for children aged 5 to 11 have been approved by the FDA and the CDC. Boosters have been approved for those who are fully vaccinated now and are available for those who are 12 to 15 years of age. I urge everyone who has been vaccinated to get your booster shot as soon as you're eligible. Please do not wait. Getting a booster is particularly important for people who are at high risk for severe illness. That means that if you're 65 and older, you need to get your booster. If you have underlying medical conditions, you need to get your booster as soon as possible. If you live or work in long-term care facilities, you need to get your booster now. If you are a healthcare worker, you also need to get your booster. We still need to mask. Everyone, even if you are vaccinated, should wear a mask in public indoor spaces. If possible, wear a medical-grade mask at this particular juncture for more protection. Medical-grade masks include surgical masks, preferably double surgical masks, procedural masks, KN95s, and N95s. We have been notified at Durham Public Health that local health departments, departments of social services, and school districts will receive boxes of durable masks beginning as early as this week. The number of masks delivered will be proportional to Durham County's population. They have already shared their delivery schedule, and we are estimated to receive 60,000 masks that will be divided between ourselves and the Durham County Department of Social Services. We will certainly announce when masks will be available for pickup, and we will endeavor to have masks available at our county-sponsored testing sites. Testing is an important tool, but testing has been a source of frustration due to the high demand here in Durham. Help is on the way. Please know that there are currently more than 30 locations to get tested here in Durham, with Walgreens and CVS representing half of these total locations. We acknowledge that wait times are currently long at some locations, but it's not impossible. You can find testing locations on our website, decodepublichealth.org/COVID testing, or at the state's website, ncdhhs.gov/get tested. And remember, if you're having trouble scheduling an appointment, testing is available without appointment at our testing sites currently at El Centro Hispano and 414 East Main Street. additional notes about testing. 16,321 plus COVID tests have been administered in Durham County since December 26, 2021. We have ordered 8,800 home tests with plans to distribute while supplies last. Our aim is to order more, but like many other locations, we are subject to shipping limitations. They will arrive next week, and we cannot wait. We recently distributed 1,200 rapid tests to our friends at North Carolina Central University in anticipation of students' return to campus. We are awaiting additional home tests and antigen tests from the North Carolina Department of Health and Human Services. We have 2 additional testing locations that will be announced soon, but both are set to be high.
We are awaiting additional home test and antigen tests from the North Carolina Department of Health and Human Services. We have 2 additional testing locations that will be announced soon, but both are set awaiting additional antigen tests from the North Carolina Department of Health and Human Services.
If all goes well, these high throughput sites will come online as early to middle of the next week. Ladies and gentlemen in the listening audience, it's simply urgent to act now to protect yourself and your family and your friends. Get vaccinated, get boosted as soon as you are eligible. We at the Durham County Department of Public Health, the county, the city, and many other partners are doing all that we can to protect those who are most at risk for severe illness from COVID-19 and to ensure that our hospitals are there for those who need care. I ask all Durhamites, this is your moment to also do your part. You can protect your family and yourselves and your friends by getting your booster shot or your vaccine as soon as you are eligible. And if you are not already vaccinated, get your COVID-19 vaccinations now. Again, as I said earlier, my message is clear. Vaccinate, get your booster, wear your mask, get tested. Thank you for your time and attention, and thank you for attending.
All right, thank you so much for your remarks. We're going to open it up for questions now. If you have any questions, please go to the mic on my left and ask your question so that you can be heard on social media and the website. Please state your name and the agency that you work with.
Also, Madam Communications Director, this is a matter of protocol. I'd like to recognize our Mayor Pro Tem, Mark Anthony Middleton. I'm still a learning mayor. He's here with us today. Our city manager, Wanda Page, is also here today. Our clerk, Diana Schreiber, is here as well. Did I miss any other city officials here today? My assistant, Amber Way, and I'm trying to see the message. Is that Leonardo and Williams, Councilman, and our attorney, Kim Raybird. Please excuse me for that oversight.
Thank you, Madam Mayor. You can go ahead and ask your question.
Andrea Blanford with ABC 11. This might be for Mr. Jenkins, but are you anticipating recommending any more restrictions above and beyond the indoor mask mandate in light of everything that you were just mentioning with the cases and the spread of Omicron? Thank you.
Thank you so much for that question. And that has been a popular question over the course of the weeks, and the answer is, at this time, no. Durham is poised to continue to lead the way, but Durham is no different than any other medium to large metropolitan area that is, really being affected by COVID-19. Much has been said, but the one thing I will say is this. There's a lot of talk about shuttering and just kind of going back and sheltering in place. But in 2022, we're so different than we were in the spring of 2020. We have vaccines, we have therapeutics, we still have the 3 Ws, and we have a lot more knowledge. So with that being said, no, we don't think there's a need for restrictions. However, we still employ people to follow those 4 things that I recommended, which was to vaccinate, get boosted, wear your mask, and get tested.
Do we have any other questions? Okay, if there are no other questions, we will close the press conference, and thank you all so much for coming today.
Recording stopped.